Welcome to Lecture 1.3, Partnerships with Families. This is a really foundational topic for students as we know that partnering with families often means supporting the parent-child relationship that is so crucial to the developmental progress of children with special needs. And so it's really important that providers in any role get some good information around effective teaming and collaboration with families. Here we have the outline of Lecture 1.3. We're going to start with an introduction to the topic as a whole with some key points that we want students to hold on to. We're then going to spend some time reviewing effective family practices. So these are, again, the main strategies that we're really trying to keep in mind when we're working with families. And then we're going to look at working with diverse family cultures. We're going to spend the most part of our time reviewing the themes from the different materials around effective family practices, and therefore expect students will get the information that they need in regards to some of the other topics by engaging with the learning materials. So if you've been engaging with any of the learning materials so far, you've probably picked up on the fact that parents of children with special needs are filling many roles. Everything from being a primary or some form of a caregiver to the child, potentially being an advocate in different settings, being a teacher. Of course, they might have roles outside of the family, being an employee, a friend, even as a parent to another sibling. Sometimes even parents are working to provide the care for their child, actually. So each experience of a parent is unique, and it's really our job to get to know what it's like to care for a child with special needs in their particular situation. And getting to know that is going to enhance our work with families in many ways, as we're going to talk about, such as being able to adapt our approach, encourage reflective practices, and many more. And so the readings and videos from topic 1.3 do an excellent job at highlighting some of the different roles and experiences of the parent. So I want to bring your attention to those. The first is the case study from the textbook, which the parent's name is Laura and her 5-year-old. And this is a great case study because it really emphasizes the unique stressors and potential emotional experiences that a parent may have. And I want to make sure that students read the part where they emphasize the impact of one responsive and sensitive provider, which in this case was the child's pediatrician, who was a really source of constant hope for the family. And that's something to really take note of. And then the case study video called Jenny's Story. This is a great video to give students a better sense of the types of services that a family might be engaging with, the types of professional interactions that they're having. Here, this is a Part C early intervention example, but it really shows how the parent can be put in that role to become the child's teacher, which is a concept that's going to be referred to throughout the reading in the textbook. Let's go over just a few major points that we want to keep in mind when considering the topic. So the first is that supporting the development of the child involves a responsive and effective partnership with the child's caregivers and families. Really, any work that we do with the child is based on this level of trust and engagement that we have with them. And so moving forward, this is going to be a theme in some of the conversations that we have. And remember the power of one supportive and nurturing relationship, and really want students to know that they can be this ally for families. Remember in the case study, it was the example of the pediatrician who was in this role. And I want to stress that it can be a provider in any role. It can even be a friend or a neighbor. But the power of one supportive and nurturing relationship is nothing to be minimized in our field. Of course, we want to keep in mind that families are the experts on their child, and it's easy to lose track of this as a provider after going to school and getting lots of information and training. But really, we need to team up and come to the table with what we have to offer, which is our training and our education and knowledge on the child's development. And keep in mind that the families have a lot to offer as well. And so when we're using their insights about the child and their knowledge of their family, together, the two of those strengths coming together can get a lot of really good work done. So moving forward with the topic, we're going to gain a better understanding of the effective practices for partnering with families and supporting the unique needs of parents with children with special needs. These are just some of the big picture ideas to keep in mind. At the top of this slide, you'll see something written that really has stood out to me as the theme of the work that I do, which is to be an early interventionist means to work intimately with families. So if you work with young children, regardless of the role that you're in as the provider, it's important to be prepared for this and know that it's part of providing high quality services. And in that regard, we really need to make sure that students or providers are getting the education that they need to be able to be in this role with families and engaging with continued professional development. These two pieces are crucial to being able to really maintain the level of professionalism, yet supportiveness that we need to have good relationships. And something else that has really stood out to me is that the style of the interactions that you have with the parents and the level of that engagement really depends on the role of the professional. So for example here, a family therapist. This is my role working with families, and I chose specifically to do family therapy work and get a degree in marriage and family therapy because I had had the experience of working with children in therapeutic preschool settings and was fortunate enough to work with some children that their parents were able to really actively engage in the program. And I just felt strongly that that was a way that I could have a big impact with the child, but B, the dynamic and role that I felt like I could really do my best work. And so the intimacy of the family work really varies by role and profession, and I specifically chose to work in a field where the child's relationship with the families is the focus of what I do, and therefore obviously I'm going to be very intimately involved with that family system. So that is the role of a social and emotional provider or in infant mental health services. But it's different for every role. So now that we have a nice introduction to the topic, let's move forward with looking at some of these effective practices for teaming with families. If you remember, going back to our reading from the first topic, we looked at some of the different principles or themes of special education in early childhood. And these bullets represent the principles that are most related to family work. So let's briefly review these. Relationship-focused interventions. This includes our role with the family. So not only are we trying to promote that caregiver-child relationship or sibling relationship or grandparent relationship, we're also looking at our own interactions and relationship with the family. Then, of course, a principle of family-centered approaches fits here because there's many ways in which we are able to provide this for families. Two examples would be including the family whenever possible in services or developmental goals, and maybe potentially following their lead whenever possible with that. We want to make sure we're offering culturally responsive programs, which we're going to explore more later on. We want to make sure we're having coordinated and comprehensive services. So coordinated, of course, we want professionals of, whoever's on that family's team to be working effectively together, but we also need to be including the family in this coordinated and comprehensive communications. And then, of course, we're supporting inclusion support. If you remember the topics that came up last time around family versus institutionalized settings, we're really there to support that family inclusion. So now we're going to review some of the themes of effective practice that have come up in this topic, and much of this material was echoed in the text. So for here, we are going to point out some important content to students and add a little bit to that as well. So the first theme that we're going to look at is the importance of using culturally sensitive and family systems approaches when we're providing services for children with special needs. The cultural sensitivity part of this is going to be explored later on in the lecture. So here I'm going to focus on that family systems approach, which really can vary based on the child, the age, the setting, so on and so forth. Both of these themes are supported by the text and apply across professional domains and settings. So regardless of you being a PT, a nurse family practitioner, we really can always take a culturally sensitive approach and include that family systems perspective, even if it's considering that child in context of their family of origin or the culture that they live in. There are 4 components of family system interventions that are mentioned in Chapter 2, so I want to make sure students go ahead and take a look at that. And when possible and appropriate, which is key, we want to include family members or other people that are in that child's natural environment, such as siblings, grandparents, child care professionals, teachers. Really some of the most powerful impacts or sessions that I've been able to have with families is when I have included these other facets of their system. Just to use an example here, I recently was working with a child that had some sensory processing challenges that were impacting their ability to have high quality relationships with their siblings. So in this one example, we did some family therapy, direct games and things with those siblings to show them a different experience of interacting with one another while building that identified child's skills at regulating and managing their sensory system while engaged with the siblings. So that had a huge impact. All of a sudden the siblings could play together more independently. They were being more affectionate towards one another and just generally enjoying things, having less conflict. And in that same family system, that child's needs were in the context of a long family line of different grandchildren that the grandparents had and had great relationships with, but this child's needs were different, and the grandparents didn't quite know how to adjust their approach to meet the needs of the child and therefore have that quality of relationship that they wanted. So by including the grandparents in one session and talking about sensory processing disorder, and reflecting with them on different times in which they had modified their approach accordingly and had more success, that grandparent was able to feel more confident interacting with that child, more willing to take care of them on their own, and really increase the quality of that relationship. So please understand that this is a huge part of a lot of our services, and something to gain comfort with as a provider. And another just example is just simply seeing families in the evenings or during lunch hours allows typically both caregivers to be involved if there are 2 in that household, and involving fathers specifically has led to dramatic changes in the families that I've worked with. So if there's any way to be sensitive to that and adapt your schedule accordingly, it is highly valuable. Another theme that comes up is addressing the parental experience. So regardless of your role with the family, one really needs to consider what having a child with special needs must be like for that parent, and considering all the other parts of life that a parent has going on. So, I think as providers, it's easy to be focused on that parent's role as being the caregiver or teacher to the child, but it's also important to be talking to them about what's going on at work, finances, or any other stressors that they may have on their plate, so we can get them any support services that we need. So again, quality services involve attention to the parent, and this happens on many levels. So you're looking at their emotional responses to having a child with special needs or just being a parent. We're looking at their stressors, their personality or temperament, and as well as their strengths and growth areas. And really what I've found is that parents are really thankful when we tune into their experience. So again, this is going to be a point of consideration regardless of the provider role. We want to assess and explore that parental experience early on in services. If we are up against barriers and we're not able to maybe see the progress we want to see with a child or a family, oftentimes it's because there's some type of family or parent barrier that we haven't addressed or fully supported the parents around. So in order to prevent time lost to not addressing this, we want to make sure that we're exploring it early on in services. And depending on your role, you might develop a specific protocol for doing this, and that should be part of your professional development or education in your specific area of focus. And really, there's a wide variety of responses from parents and families that we see. This can really range. Not every family experiences the same level of stress or the same challenges. What may be a concern for one family is not a concern for another. So, of course, we're keeping that broad perspective and really trying to get to know the family's experience without coming in with our own bias and preconceived notions. I will say, though, that a really common experience that I have had come up with children that have these delays is that common experience of ambiguous loss. So we might be grieving milestones that the child would have been making at certain chronological times. We might be at times seeing, some loss around that sibling relationship if it's been a time when there's been a lot of conflict there. So all of these types of things that we don't think about, maybe going to the park and feeling that loss when you see other children doing things that your child may not be able to. So that's something that we want to keep in mind. But again, the textbook case study gives a really nice introduction to the types of parental responses we might see and really the progression of some of those feelings. And so keep your eye out for that. But the text in general does a nice job of outlining the emotional supports that a family might benefit from and the types of responses they have. So again, just a big focus there. And with addressing the parental experience, we can really turn to the field of infant mental health to give us some guidance around how we can do this. Again, both supporting that parental experience and understanding the family's culture. And it's good for this because the field of infant mental health is based on relationships. So it really focuses a lot on different practices that we can do that support our relationship with the family and that parent's relationship with the child. And we do this by supporting parents to increase their reflective functioning. And we do this by using reflective practices. So if you are reading materials and see those words, those are going to start to become more and more heard of in the field of both infant mental health, but supporting families in general. And so an example with that ambiguous loss that we just talked about, this is an area where it's really great to use that reflective practicing, where a family might not be really aware of what's bothering them. And so we might be able to ask some reflective questions and they might be able to identify that ambiguous loss is happening, as it can kind of sneak up on families. Again, or not, but that's an example of a topic that could come to light through some of those reflective practices. So just to be sure students know what we mean by this term reflective functioning, we really mean that ability to understand your own emotional experience and to be able to step back and look more deeply at your actions, your thoughts, your feelings, identify more where they're coming from, and through that process also be more reflective about what's coming up for the child. And so this allows, as you can imagine, parents to have better outcomes with tolerating a wider range of feelings themselves and having more acceptance for a wide variety of experiences, because they're just better able to understand how it's all working out or playing out in their daily life, which leads to better outcomes for the child, because oftentimes that parent's able to be more empathetic or understanding as to what might be going on for them. And so we want to use empathy to really mirror parents' experiences and feelings, as you read about in the book. This is a way of being reflective to help them understand more about what's going on. And in doing this, taking that reflective stance, it increases our own understanding of the parent or caregiver's experience, so then we can tailor our approach accordingly. So the reflective practices, again, have better outcomes for the child, better outcomes for the parent, and better outcomes or provide us better opportunities to support families. And so when we're taking this reflective approach, it really means that we are meeting the family where they're at, as it mentions in the book, and we're not trying to necessarily change their emotional experience. Sometimes they do need our support with that, but oftentimes through that reflective opportunity, the parent will work through things on their own. And so it allows us to just focus on meeting them where they're at. Another theme in effective practices is being responsive and adjusting your approach as the provider. As we've already mentioned, interactions with families really vary by the role, and providers need to adapt accordingly. That's on us. So we've already talked about how, using the example of my clinical role with families, how much I'm involved in that family system versus the role of a special educator may be very different. They may have very different interactions with the family. They may be focused more on the family's educational goals for that child and how to increase their involvement with the program, so on and so forth. So we really need to assess the appropriate way to engage with parents and families in your setting based on your role. And we want to get to know our families so we can really base our approach off of their needs. And so, again, that bullet here, we want to adapt our approach to the best fit of the family, both their needs, their culture, their personal stressors. And then lastly, we need to adapt our approach based on the age of the child. A good example of this is that younger children often require more involvement for parents as they have less ability to self-generalize. So for instance, if a child learns, let's say, communication of requesting different things for a mealtime, they're going to be less likely to go home and generalize that on their own. Really, we need the parents and the caregivers to be highly involved, to be doing the same thing so that child can more easily generalize the skill from that school environment or therapeutic setting to the home environment. So as a theme, younger children, you're going to be interacting more with parents. Here we're going to review some of the themes that we see across different settings and different age groups as far as family involvement and some of the differences and the similarities in that. And so we're just going to briefly use this as an overview of general trends. And it can also be nice for students to just think about if they see themselves going into any of these roles, how comfortable they feel with this type of involvement with parents. So let's start with the first one, which is early intervention or Part C services. This is provided to our youngest population of children, that 0 to 3-year-old age. And because of that, in many ways, this can be a model for family-centered practices because there is such a focus on that natural environment and family setting. And so the video that you're going to watch, titled Introduction to Early Intervention, is an excellent window into the types of engagements that families are having when they're in that program, as far as with different providers and the general approach that's taken to include families. And you'll see it's a nice video in that way that you may be able to think even how some of those same principles or strategies for involving the family could be used later on in development as well, or later ages. So the next setting that we're going to look at would be special education preschool and beyond. Specifically with preschool, we have lots of different educational settings in which young children with special needs are getting their educational services, one of them being involvement in programs like Head Start, where 10% of the children who are using that program are to have developmental disabilities or delays. And so that's an example of one program, but really that has a high amount of parent participation, as we're going to go over. But other forms of special education settings may have a very different approach to family involvement. So this can really vary, but it is common that families are involved to have input on the educational goals. That's a very common practice in educational settings. But specific to Head Start, we are going to watch a video about this because it's got a really nice coaching model that comes along with Head Start that, again, children and families of those with special needs are going to be potentially involved in. So that's nice to get a window into what that looks like. So see the video, Learning in Partnerships, Using Data and Reflective Practices and Programs for that example of what it might look like in more of an educational setting. And that video is also great because it talks a little bit about how they use reflective practices to support the teachers in that setting as well and families. So pay attention to that piece there. And the last one we'll look at is clinic services and intervention settings. So this is where a child is going to a setting outside of the home or outside of the school to develop those areas that they're working on. And so within early childhood standards, the standard of practice is really still to involve the parent in some capacity. This is going to vary between different providers' ways of practicing. It could vary by the developmental domain in which they're focused on, the general nature of that service, or potentially even the culture of that family or community. In the infant mental health field, there's a trend right now where the phrase is that there's less parents in the waiting room because we're seeing the importance of including parents into their child's therapy services. So that is something that is trending, at least in that one domain. And that could really be very depending on the appropriateness. For example, if a child's doing trauma-based therapy where it's child-directed play therapy, the parent might not be involved in that, but perhaps in another modality would be. So that's just a general overview. Working with diverse family cultures. And here we're looking at those culturally sensitive practices and special populations. I just want to note this is a huge topic, and I wanted to emphasize it here in the lecture so students make sure that they know the importance of it. But again, this is something that you're going to continue to need education and professional development around to really get to know the specific populations that you're working with, and then even within that, the specific family culture of those that you work with. So working within those diverse family cultures, we're looking again to that influence from the infant mental health field, where we know that we want to acknowledge our own values, biases, tendencies, our own culture and ethnicity. And reflective practices here are crucial, as these cultural values and beliefs and attitudes tend to be based unconsciously. So we're acting out on these unconscious thoughts that we have, and so to step back and be reflective in our own capacities, it can be really helpful to identify different dynamics that may be getting in the way, or perhaps are enhancing the work that you're doing with families. Cultural sensitivity is about attunement and interpersonal sensitivity. Prior knowledge forms a hypotheses, and that when tested may change our perceptions. And so just to expand on what this means here, it's saying that to be culturally sensitive means that we can come in with some prior ideas of maybe that ethnicity or some ideas about that family culture from what we know about those in our community. But those are really just our hypotheses. And then we're engaging in these sensitive interactions with the family, with the parent, to really test out whether or not our knowledge is accurate or not. And then we need to be open to changing our perceptions as we get more information. And I just really like this because it stresses that we really, it can change, and that every new family that we meet with, we need to take this sensitive approach and have this curiosity that will lead to a more respectful and responsive interaction. This also comes from the infant mental health field, this idea of taking a contextually congruent approach to cultural sensitivity. And this brings our attention to culture and, of course, cultural factors, but also in balance with current and historical factors. So to give an example of this, we're exploring the family's culture and some of the things that are important to them, which could include religion or different beliefs they may have. And these could be things that are carried on with their family, but then we need to look at that in context with where we're at now. And where the family or their culture was historically. And so by that we're helping the family integrate their culture into the current situation. And so it it really helps to again promote that sense of curiosity to understand the family's culture and to help them reflect on how that fits with their current day situation. And here's just an example of why we need to take that approach. We can't just have a one size fits all cultural knowledge for different groups, populations, even, the belief of what we think of families with children with special needs. That's a culture. And we can't do that because cultures change and we need to be responsive. If you look at the pictures on this slide, you can see the vast differences here between each of these different families. On the far left, we might have a very formal type of family structure where there's very clear roles that adults and children play. Moving forward in time, we have a little bit more laxed approach to family in the middle here. So we need to, if we're still providing services based on that more rigid family system model, and here you are interacting with this family in the middle, there might be some clashes. So we need to change our perspectives. And moving on to the family on the right, this picture provided a good example for me of the popularity of single-family households. And so if we are providing services thinking of that traditional nuclear family culture and we're working with a single-family parent, that's going to clash. So we really need to be responsive and take that holistic approach to consider, what has this family's cultural experience been in the past, even in the generations before them, and how does that incorporate into where we are now? So I just really like that approach. And again, if you want more information on both reflective practices or some of these cultural perspectives, there's a lot more resources out there on that and many journal articles and books as well. So to sum up, when we're working with diverse family cultures, we need to get to know the families that you work with, and we need to be curious, we need to be reflective, we need to use our resources to, again, develop hypotheses and test them out and get families supports that they need. And we need to get professional development so we can be up to date with the most efficient standards or effective family practices that are out there. The book does a nice job of going into some factors around different ethnicities and language differences. One point that I wanted to stress is that culture does not equal ethnicity. Ethnicity is more around the family's origin, of their physical origin, where the countries that they have come from, the language that they use. Culture is different. Culture is something that's unique to each individual family. And remember that when working with those special populations, for example here, single-parent households, families at risk, families who've experienced divorce, we really need to adapt our approach accordingly, use the research that we know for those populations, and again, stay curious to get to know that family in specific. We aren't going to go as much into these last two bullets, so we're really expecting that students will get that information from the other learning materials and get any additional information they may need later on in their personal or professional development.